All right, ladies and gentlemen, we are here live for the interview now of Demonica Baby, and we're here with Dr. Ariza and Dr. Jake Townsend, and also Joe Play. And then when you're ready, Demonica, please, we're gonna have you do macros check. So I need you to throw up all your macros, please, and thank you. And then Joe's over here is gonna read the rules over here. All right.
All right, perfect. So I'm going to read you the HP rules and stop me anytime if you have any questions. All right, do not resuscitate patients on any streets surrounding the hospital. The gang territories, which are the blue territories, or the army base, do not serve patients who have their weapons out. Do not stand on the main lobby floor. Do not go AFK while on duty. It's a 3-day ban demotion. All funds return. Only 2 staff members may be at each desk in rank order, which is brown, maroon, blue, white, and then green, and up to 3 may line up down the hallway, also in rank order. If your medication restock wait time is over 5 minutes, then go on runs, med runs, or CPR runs. If your wait is under 5 minutes, you can wait in the cafeteria behind the lobby. Do not use the front door. Only rank 6 and higher can use the front door. Only rank 7 and higher can use the front parking lot. Do not ever spot on the bus. Radio checks are mandatory. You'll see in the chat. In Flobby, you'll see the radio check is in progress. People answer with 10-4. You gotta answer with a 10-4. And the last one is you cannot attend the blue territories without a rank 7 or higher present. Do you have any questions on the HP rules?
No.
All right. The MD rules are MD1 refusal to give medicine to civilians or resuscitate a person without a justified or reason, provided that there's no threat to the medic's life. MD2 is use of firearms with medical staff is strictly prohibited. Punishment is dismissal. MD3 medical faction members must follow all established project rules. MD4 personal use of official medical vehicles for personal activities is prohibited. MD5 issuing medical certificates outside the hospital setting is forbidden. That includes doing medical stuff on vacation. MD6 selling medical pills or resuscitating players during life-threatening situations like firefights and other active threats, including a threat to the patient, is prohibited. MD7 gang association, intentionally associating with gangs, committing major crimes like theft, vandalism, or murder, or affiliating with factions during events is prohibited. Punishment is dismissal. That includes you cannot ride in the car with gang members. You can't hang around the gang house. If you receive a call to the gang house, you could go there and do the CPR and give some meds or pills, but get out of there. Don't hang around there. Don't be caught in riding with gang members in a car and stuff like that. MD8 is disrespectful behavior toward any individual is prohibited. Punishment is one reprimand or dismissal based on the faction leadership's decision. MD9 is failing to follow orders or observe rank-based subordination. MD10 is using personal vehicles for EMS-related tasks is not allowed. MD11 medical personnel must roleplay their duties appropriately, including interactions, dialogue, like announcing assistance and checking your surroundings during emergencies. MD12 attacking civilians with a taser, weapon, or physical force without an RP reason. Punishment is dismissal from the faction. Do you have any questions on the MD rules?
No.
All right, RP 13 on RP behavior within game factions, including unlawful release of prisoners or execution of civilians by the police. Punishment is exoneration from the faction. and or from 30 minutes at one state jail to a 3-day ban. RP14, any form of non-consensual sexual actions, including simulation and explicit dialogue or actions, or use of ethnic and or LGBT plus slurs or excessive attention. All sexual actions require OOC consent. Such actions should not occur in public or frequently visited areas. Punishment 60 minutes mute or 24 hours up to a 30-day ban. RP15, intentionally provoking faction members for detainment or disrupting faction operations is prohibited. Punishment is 30 minutes in jail. RP16, any criminal acts toward emergency medical personnel are prohibited. Punishment is 90 minutes in jail to 12 hours of ban. You have any questions, any of the rules?
No.
All right, so now we're going to ask you a couple questions. Most of them, there's no right or wrong answer. So just answer according to your ability. Mods, you want to ask a few questions?
Yeah. What's MD9?
I'm sorry, can you repeat the question?
What is MD9?
I believe it's non-compliance with orders.
Yep. And anybody else want to ask a question to her?
Yeah, sure.
Maybe,
Yeah. Have you ever been in any RP scenes before?
Yes.
Awesome. That's cool. If you ever have any help or questions about RP, you can definitely just add me and give me a shout. I'm willing to help out anytime.
Okay, thank you.
Zarya, maybe want to ask one question to be for the shadow.
I got no more questions.
All right, so I'll ask the questions. Why did you want to join the medical faction?
I like helping people out, and it's something that I wish to do outside of the game as well too. So it's a learning experience for me.
That's great. What are the most important qualities that a medical professional should have?
Good communication with members and positive attitude and just overall positivity and in the faction.
Okay, and what would you do if you saw me and Mods having a heated discussion, a heated argument on floor 1? What would you do about it?
I would probably pull you guys to the side and let you know that, it's not okay to be doing it in front of, civilians. It's not professional. And maybe try to work something out away from everybody else. And if that doesn't work, I would probably have to speak to a higher up and just input what I saw.
Yes, that's correct. Also, you make sure it's on, so if in case anything needs to be reported, you always have the body cam to report it.
Yeah.
What would you do if you got an emergency call and you came to the scene where the call leads you to, and there's 4 bodies lying there, a cop, a civilian, a medic, and a gang member? Who are you gonna pick up first?
I would pick up the one that sent the request first.
Okay, okay. Yep, you definitely been through an interview before. So what are the 3 areas you're never allowed to pick anyone up?
Around the hospital, in the territories, and during a shootout.
No, the areas, 3 areas.
There's 3 areas.
So you said 2 areas, but there's one more area. like physical areas on the map you're never allowed to do CPR.
And the gang houses?
No, the third one is the army base.
Oh,
Yeah, so like I said before, the gang house, you could respond to calls there. You just go in and out, do the CPR in and out quick if it's safe. If it's not safe, obviously, if any call's not safe, you could go ahead and cancel it and turn around. But yeah, so those are the three places you're never allowed to do CPR, no matter what: the army base, 4th Street surrounding the hospital, and the territories.
okay. Noted.
All right.
All right, we gotta ask like 10 questions, so that was about 6, 7. Gotta get some more. How do you keep your coworkers motivated?
Maybe just by I'm sorry, that's a really good question. Probably just keeping positivity, like the energetic vibe going in the hospital, because I know sometimes it can be really lonely in the hospital, especially during the nighttime. So maybe just, talking to them and maybe doing rotations, changing out the shifts.
Okay, yeah. What? Um, 1 second. Sorry, I just blanked out.
What's RP13?
I'm not so sure at the moment. But I will look into it.
Yeah, it's kind of hard to know all of them, which numbers they are. So like,
What should you do whenever the front desk is full and down in the hallway has 3 people?
I would probably go out to do med runs or do the I'm sorry, I blanked out on the name, but pretty much picking up civilians outside
yeah, CPR call.
CPR rounds. Thank you.
Yes, that is correct. All right. So if no one else has any questions, yep. So that will wrap up your interview.
Yep.
Great job,
So
mods.
this will be wrapping up your interview, and we'll go, and then I'll go ahead and post it on Discord when it's ready, and then yeah, and by tomorrow we will have your rank up ready. Good job.